Dr. Scott Atlas, Stanford University, formerly with the White House Coronavirus Task Force, is with us. Scott, it's good to have you back with us on BlazeTV, brother. How are you?
Okay, thanks for having me.
So let's start there. First of all, Merry Christmas, but let's start with the announcement you made yesterday to step away from the White House Coronavirus Task Force. Why did you make that decision, Scott?
Well, it's very simple. My 130-day term as a special government employee is ending this week. So it was a temporary position, an advisory position to the president, and that was the terms of that position.
What can you tell us about where things stood in the battle against the virus when you walked into that job 130 days ago, and where things stand now 130 days later?
Well, my role really was to provide a policy advice to the president based on the science, and that policy advice always was not just using the science directly, the data, the up-to-date data. It always was also taking into account the harms from the pandemic itself and the policies. That's what a public policy person does. That's what anyone in a leadership position should do. And that wasn't what was understood or being considered as much before I came there. So that was my role. And, you know, we did quite a bit to do, number one, really target the protection to high-risk individuals, to the people who are the most vulnerable. And that was always an intent of everyone in the White House, including the president. And I think we stepped that up tremendously with more careful monitoring of the situation in nursing homes and assisted living facilities, tying monitoring and intensifying testing to protect high-risk seniors, particularly when there was a clinical indication that there were more cases in the community. We prioritized tens of millions of tests to nursing homes, new state-of-the-art tests. We prioritized PPE to nursing homes. We prioritized and instituted something new, which was not just protecting people inside nursing homes who were seniors, but alerting seniors living independently in the community. You know, we tied infection control programs to nursing homes with hospitals. A lot of that work was done by SEMA, Verma, and CMS. We really also put forward a rational way to safely open schools, because keeping children away from in-person schools is enormously harmful. And, you know, we also made sure that everybody in the country really understood that there was a way to open schools, that the cost of not opening schools, of continuing lockdowns, was enormously helpful, not just on massive health issues that were being skipped, but also on psychological distress and mental health. It was very destructive and is destructive to have prolonged lockdowns on families. It sacrifices our children, and it's particularly harmful to people in the working class and the poor. As one of my colleagues, who I was always being advised, of course, by some of the world's top epidemiologists at Harvard, at Oxford University, all over the country and all over the world. One of my colleagues at Oxford was commonly saying lockdowns are a luxury of the rich. And, I think that's very important. As a public policy person, your goal is to look at society and try to introduce the best policies for the best public good. And I think, we were very successful in trying to do that. It's very challenging. There's no question. The other thing I want to say is that, all the positive things, all the timelines that the president put forward, that I put forward, that were also pilloried about the timelines for the vaccines under Operation Warp Speed, which was an enormous success, historic success by the president and the team and the individuals who actually did the work on Operation Warp Speed, who are not the people who go on TV, who are not the people whose names are well known. But the vaccine timelines, the drug timelines that we put forward were exactly correct. The data about children having low risk and not being frequent spreaders were exactly correct. The data that basically protection against infection was not completely shown by just a level of antibody testing. That was exactly correct. Everything that I said really was exactly correct based on the science, and the advice about the lockdowns and the serious harms from the lockdowns is now being acknowledged. So I think we need to, move forward as a country. There's a lot of things that are happening that are positive. Of course, it's a tragedy when so many people die. But, we know about the virus. We know that the infection fatality rate is much lower than we thought. We know that the in-hospital stays are much, much shorter. We know that less people die when going into the hospital. We know that most of the people getting the infection are otherwise healthy, younger people that do not have a significant problem. And so, we're seeing some, we're going to see delivery of vaccine in a matter of a couple of weeks here. That's an enormous success from the administration and from Operation Warp Speed, and I think people should feel good about that.
Well, there's two things I want to ask you about here, but before I get there, I just want to say this in reply to everything you just laid out for our audience. And I've said this to them I'm about you. I'm just going to say it to you in front of them. I can't thank you enough for the work that you did on that task force, and you've done this entire year. And frankly, I think that this year would have gone a lot differently on many fronts if you would have been on that task force a lot longer, if your 130 days would have expired sooner than here at the beginning of December. And so I just wanted to say, before we ran out of time later, thank you very much for everything you have done and all the effort you've put in and all the crap, frankly, you've taken for following the science as well. I wanted to get a chance to say that directly to you, Scott. So thank you.
I appreciate that. The people working there were working very hard. I didn't walk into my first task force meeting until August 12th. A lot of things happened before then. And everybody works very hard. I think, we just want the best for the country. And, of course, the new team that comes in, I wish them the very best. Because we all want the best for the country. I do want to say something, and I don't know if you'll ask me or not, but I think one of the bigger issues, there are some fundamental issues here that are beyond the pandemic that I think we have to look at as a society. And one of them is the ability to have the free exchange of ideas. Mm-hmm. And I think in America and its universities, I think we need to make sure that we have the free exchange of ideas, because that is how science ends up forming its truths. Okay, when we cannot have the free exchange of ideas without intimidation, without rebuke, without trashing someone's reputation, I think we're in serious trouble, because we need that exchange of ideas to come to the truths, to solve the pandemic, to solve any further crisis. And frankly, the exchange of ideas to ultimately arise at science and truth is the basis of any civilization. And so I think it goes beyond the tremendous harms to individuals' reputations that is unacceptable. And it goes to what the basis of democracy and really our whole country is. I think we have to be very cognizant of what happened here. Amen
to everything you just said. Okay, I've got 5 minutes left, and I have two big picture questions I need to ask you about moving forward. Because when a new team comes in, depending on if the president's election challenges are upheld, or in the more likely scenario that they are not, and Joe Biden is sworn in, I think these two things I'm going to ask you about are where there is going to be a lot of debate going forward about what our public policy should be. The first time we had you on this show, I asked you how confident you were that, because we were still doing the whole 15 days to flatten the curve. And hey, how can you flatten a curve if you don't know when it began? When did the virus arrive? Because that's a big question. It changes the IFR, the CFR, everything. All right. And what we've seen in the last 24 hours in our news cycles is we have seen graphics where the flu has literally just disappeared from all statistical modeling. It's just like gone, disappeared. And now the Wall Street Journal is saying that CDC scientists believe that they can go back to pre-Christmas of last year with COVID being here already circulating in the United States. Now that we're further into the data on this, and I can understand why when we first had you on last spring, that's a tough question to tackle. But is that a question that we must know the answer to? When did it arrive? Because I think it shows a lot of these mitigation strategies that we're still discussing and debating. I think that determines a lot about what their future effectiveness would be if it was already here circulating before we had media awareness of it. What are your thoughts on that, Scott?
Well, I think we can say that, the lockdowns don't work. I mean, you do the lockdown and the virus doesn't go away. The infection does not disappear. It doesn't magically go away. All the countries have cases exploding through their mandates, through their lockdowns. We see it all over the country. We see it all over the world. We do not really see differences in states that did open versus those that had mandates and closures. So, the question of when things first started is still under debate, and I don't have a strong way to factually say when things started. And I don't really like to speculate. I like to go by what we know as much as we do know, because we know quite a bit. But we do know that these policies, the ultimate policy is to protect the high-risk people, and the cost of not opening society to lives lost is enormous. Mm-hmm. So the right strategy, and this is a strategy that I endorse, that was endorsed by thousands of epidemiologists and public health scientists all over the world. It is the data. It is not everyone may agree, but some of the best epidemiologists in the world from Harvard and Oxford and other universities and other researchers, the people that do the research, signed on to that sort of targeted high-level protection of high-risk people. And we know that opening society is essential to protect people, to save lives, to save our children. It's a complete fallacy to think that locking down somehow gets rid of the virus and didn't do the harms. And this was the huge failure of public policy, has been the lack of awareness that the lockdowns, the policies themselves, destroy people. That is a failure. That is an epic proportion failure. It should never have been stop COVID-19 at all costs. These people are completely wrong. They may never admit they're wrong, but that's not about being right. It's about doing the right thing.
Well said. Final question. I've got about a minute for a hard break. You probably can't answer in a minute, but if you give me something, I would appreciate it. Several months ago, the New York Times did a huge story on the sensitivity of our PCR testing, what the threshold for a positive test was. We have seen scores of false positives in the NFL, where they have some of the best private healthcare in the country. Penn State football reported a few weeks ago they have had 44 false positives within their football program. Are we overblowing this with the sensitivity level that we are putting on our testing in America?
Well, the answer is, of course, because the testing that's done using a technique called PCR detects both infectious, contagious people, as well as pieces of virus that are neither contagious nor even functional. So they get pieces of dead virus. This is a kind of esoteric stuff that has now made its way into popular discussion, which is good. That is that the PCR tests themselves, depending upon the way you do them, are showing basically false positives. So that's done enormous harm. You're confining people that are not contagious. You're stopping people from working who are not contagious. And in a sense, it's a false positive. The newer antigen tests are typically detecting people who have contagious virus. So that's very different. But, there's been a tremendous amount of scientific error done. And even the New York Times has written about this. And I say the word even intentionally. So yes, there's been a tremendous amount of misinformation and bad science perpetrated onto the public, and it's been extraordinarily harmful.
Dr. Scott Atlas, Stanford University. We don't be a stranger. We still want to talk to you every now and then, brother. God bless you and Merry Christmas. All right, we have to go.
All right, thank you for the time. Appreciate
You bet,
it.
and thank you for everything you've done for the country this year, no doubt. We'll come back with hour 2 here in a moment.